The postnatal examination is very important. Again, as I said, the first 24 to 36 hours is very critical for various aspects, and the earlier we pick up problems, the better. So the initial assessment after delivery is done by the nurse, midwife, or doctor attending the delivery. Depending on where you work, the setup may be different, but a careful examination is important for certain parts. So whether the oral cavity is normal, whether the eyes are normal, the limbs are normal, the anal opening, it's very important to stretch the buttocks and make sure that the anal opening is seen clearly. There is nothing abnormal in the genital area, because these are things which have importance on the health of the baby. Before discharge, of course, all the babies will have a full examination by the pediatrician, and that should include the head, face, and mouth, cardiovascular system assessment. Red reflex is important, and the hips as well. It's these two are taken as screening measures as well. So it's very important that we document clearly all that it is done, because they can come back and bite you. Again, palate examination, I mean, we shouldn't take it lightly as well. I mean, when you examine the oral cavity, make sure the mouth is well open. If you can't see the full palate, use a tongue depressor or use your gloved digits to feel. Look for features which may affect the feeding as well, because support for the feeding is very important. I mentioned already about cardiovascular system, that we feel the, femoral pulses, especially in the first 24 hours. You may continue to feel it even if there is a problem like coarctation, because the patent ductus is still open in many of these babies. So it doesn't rule out, and the critical heart disease screen adds on to this process as well, to make sure that we don't miss out heart disease. So you examine the baby thoroughly initially, but again, before discharge, make sure you feel the femoral pulse, and the saturation, the critical heart disease screening is done as close to discharge as possible.